Hello everyone who's online, Nurse Miss Mary is online today. Miss Mary is live today to take your questions on YouTube. So let's know who is watching, who is joining us. It's morning. I believe a lot of people are busy. Yeah, I decided to go live today because I came to work earlier than usual, so I'm hiding. I am going live. Who is live? Just say hi if you're live. Say hi, say hello if you are live with me. I'll be glad if you drop a comment. I'm here to take all the questions, all the pending questions for those that are online, that are not at work. So I am here to take all your questions and provide answers. You can drop, thank you, Bester Bassi. Thank you, Ohome Martins, Sony Nathan, Ashaba Gloria. Thank you all. You can drop some beautiful comments. I'm here to take all your questions today. I came to work earlier than expected and I decided to come live. Wow, this is great. You see why I love my YouTube family? I have been on Facebook and I didn't really get a lot of people dropping comments. Come and see now. See my Facebook family. Hey, it's actually great having everybody around. For those that are seeing me for the first time, my name is Nurse Miss Mary. I think Chidibelu already said it, the nurse with the difference. I am popularly known as a nurse with a difference. I'm going to call as much names as I see here. Ogu Perpetual, Chidibelu, Musa Bokare. Sorry if I'm not pronouncing it well. Captain Joker, Clifford Ezebo, Ihebon Anthony, Abubakar Rodiat Yetunde, David Akuwafo, Stephen Ba, Ungowa, Ashaba Gloria. Talk about safe days, okay? Jacob Ugu, Tony Bashoru, Olwe Bubechi Debelu, Kabina Jabi, Alepa John, Sony Nathan, Ashaba Gloria. This is me saying thank you. You look beautiful today. Thank you very much. Chukwemeka Samuel Kelem Oluwa Pelumi. Thank you very much. Jimol Aziz. Thank you, Nurse Miss Mary, for all you do. Thank you very much for thanking me. I'm very happy. Walter from Zimbabwe, thank you. Oh, Isian, I'm your personal nurse. Yay, I'm Isian's personal nurse. Thank you. I'm new here, but I want to know my safe days. In February, I saw my period on the 14th. In March, I saw them on the 16th. April. Okay, I think we should use, for those that are asking about safe period, let's use Ashaba's Gloria period to calculate her cycle. Gloria, are you here? If you are here, just drop a comment so that I know before I continue. Gloria, drop the comment if you are still here so that we can use your cycle to calculate the safe period. Gloria, are you here? I want to start. I don't want the situation where you tell me to go over again. Okay. So I am with the calendar here. You can say I'm with the calendar here. It says I am new here. Okay. Gloria, have you subscribed? You have to subscribe. You can't be new here and you've not subscribed yet. Okay, but I want to know my safe days in February. In February, I saw my period on the 14th. So on the 14th, I've programmed 14th. So we're going to count from 14th of February to 16th of March to know how many days cycle first. So I'm going to count now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 20, I'm coming now. 20, 27, 28, 29, 30, 30. Gloria, from the first part, it's possible you have a 30-day cycle. Yeah, 30-day cycle. 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. Okay. Looking at the dates you gave, Ashaba Gloria, you have a 30-day cycle. So your ovulation date should be on the 16th of the cycle. This is going to be difficult to explain. So what I would advise you to do is to watch the video on how to calculate the cycle. How to calculate it is that you see that 14th now, 14th of February, that's your day one. 14th of February is your day one. Start calculating from 14th of February to the 16th of March. That will give you a day before the 16th of March. That's going to give you a 30-day cycle. So when you know your cycle now, you know the full cycle, subtract 14 from it. When you subtract 14 from it, that is going to be your ovulation date. So 5 days before your ovulation day is not safe. 2, 3 to 5 days after your ovulation date is not also safe. So during that period are your unsafe period for you to have sex because you're going to get pregnant. I don't know if you understand, but if you don't understand, I would advise you watch our video on how to calculate your ovulation. Yeah, I think we have several videos on that. I would advise you watch it. It's on our YouTube channel. You can watch it over and over again. But just know from what you send, you already have a 30-day cycle. And your ovulation day, that's the day the egg is released, is on day 16th from what you sent. I don't know if I make any sense. Just let me know, Gloria. Then somebody asks, which food is one supposed to take after cesarean section? See, what I understand about the cesarean section, different regions with different way of operating. Like where I am at the moment in the UK, after an operation, our patients can eat and drink. Again, our parents can take water that very day safe. They can eat and drink. So what I would advise is what your doctor says is what you should follow because they know what they did. For example, we had ectopic pregnancy surgery. Now, our patient can eat and drink post-operatively as far as they can tolerate it. So it all depends on your location, what the doctors have used, and that's how they will advise you on what to take afterwards. But I think basically in Nigeria, you have to start with some pap, some soft diet first. Then as time goes on, you can increase to strong food. So for me, just follow what your doctor says at that particular moment. They are doing some cleaning. You know, I'm at work. I came to work early, so they are doing some cleaning. Oh, not here. So it's down. So I think they are doing some cleaning down. I'm not looking so fresh. Thank you. Fungal infection around my chin area. I'm tired of medication. Please. What medications did you use? Like for fungal infection, you get some antifungal cream. As the name implies, antifungal cream. So that's what you're supposed to use. I don't know which medications you have taken. Ganizi Tembo. Then what? Another question from Agu says, what is the solution to azoospermia? For azoospermia, we can't say this is the solution. We have to know what is actually causing the azoospermia, because when we know the cause, if the cause is treatable, it's easier for us to cure the azoospermia. We have to know what is actually causing the azoospermia, because azoospermia or oligospermia doesn't just appear all of it. So there has to be something that is causing it. We have to know what is causing it to be able to know, okay, if there's a way forward or not. Okay, I think, like you said, so it's a little bit noisy because somebody is cleaning, so just bear with me. Hello, Nurse Mercy. I am Fatima from Nigeria. Can you talk about how to reduce bloating and nausea during early pregnancy? Thanks. Okay, in terms of nausea and vomiting, then bloating is what some people cannot run away from when it comes to pregnancy. Yeah, it's what people cannot run away from when it comes to pregnancy. What I advise is you get some meat. You know this meat. You know meat, something that looks like it's peppermint. Meat. mint. Those sweets that has meat in it. You can be putting it in your mouth always. That can also help. Some people chew gum to help with the whole nausea and vomiting thing. You get, and also avoid food that smells very well, like they have high food that irritates your nostrils, like the smell comes to your nostrils very well. So you avoid things like that because that might aggravate vomiting. They always take meat alongside, always put it in your mouth, like it keeps the mouth refreshed over time. What is the best drug for gonorrhea? Gonorrhea is a bacterial infection. Okay. Sorry, I have to reply this message. Not my meal. I have to reply this message. It's important. Sorry, just give me some minutes. All right. Okay, let me see. I was asked you a question. Said, what is the best treatment for gonorrhea? Gonorrhea is a bacterial infection. So a good antibiotics, we do the treatment for gonorrhea. Yeah. Ma, please, I have a complaint. Let's hear the complaint, Michael. Then another one said, I am 42 years old. I have painful scanty menses for 1 week. I want to know the cause. First of all, have you gone for a test? Have you done any scan? Sometimes this painful menses might be normal. Yet, why sometimes it might be some underlying medical conditions, yet such as endometriosis. So what I would advise, if it is recurrent, it is painful, it is heavy, I would advise you speak to a doctor and get some useful scan done. I made a video on the cause of painful menses. You can watch it and get insight on the various causes that can cause painful menses and know which one applies to you directly. Can I get pregnant the next day after ovulation? It's possible to get pregnant now because the egg you release lasts for 24 hours. So if my egg is released today at about 12 o'clock or 12 p.m. So 12 p.m. the next day, my egg, 11 a.m. the next day, 10 a.m. the next day. So the egg might still be active. So there's a possibility of getting pregnant a day after your ovulation. Okay, another one said, please, what is the best drug for pile, for hemorrhoid? Hemorrhoid. You know, pile, we have both the internal pile and the external pile. Yeah. I can't really answer that question now, so I don't give wrong information. So I think that's something I will work upon and make a video on it. So my head is blank when it comes to that pile, but it's something I will have to work on it. But I know some people use surgery to remove it. Pile is known as hemorrhoid. Yeah, sorry, I'm getting it wrong. Sorry, just give me some time. Let me check my. I don't want to say what is wrong. You understand? So just give me some time. Yeah, it's hemorrhoids. I was like, I have to be sure. Yeah, I'm correct. So piles are hemorrhoid. So I'll have to work on it and give you and give you a useful video on it because I don't really have good knowledge on that pile. So I'll have to work on it. You get it? I don't really know the best drugs for pile. I work in the theater. All right, please, nurse, I want to ask, is it normal to feel pain like for a week during ovulation? Some ladies do feel pain. It's normal. But if it's something you're worried about, you can speak to your doctor and get some scan done to rule out any underlying conditions. Again, so some people feel pain during their ovulation. I thought this place was going to be quiet, but they have some cleaning, some movements ongoing. Sorry if... Do I correct? I already say something about that. We have to know what is causing the azoospermia to be able to know what is the cause. To be able to cure it, we have to know what's actually causing it. Another says, what is the solution of getting routes of ulcer? Getting rid of ulcer. Is that what you want to say, Suni? Because ulcer cannot be totally eradicated, but dietary modification, changing your diet and some things you take is going to help relieve the pain. But you can't totally eradicate ulcer. You have to just work on your diet, work on your lifestyle to help with ulcer management. Ulcer can be managed, but I don't know if it can be totally eradicated. But it's being managed by what you take in. Hi, beautiful. Much appreciate your videos. Watching for Solomon Island. All right. Thank you, Dine Miss Hookari. Hi, nurse. Please, is Lipton tea every morning good for 28 weeks pregnant woman? Lipton. What does Lipton contains? What does it contain? What kind of infection, Agu? We have to know what kind of infection. You can't just say infection is causing the azoospermia. We have to know a test has to be done. If it's an infection, the infection has to be treated. If the infection is treated, definitely the dyspepsia will be gone. If it's actually the infection that is causing it, you have to treat the infection. Once the infection is treated, then you don't need to bother about azoospermia. You get lip tinting. What I'm going to check now, I'm going to check what makes up the lip tinting before I can say if it is good for a pregnant woman or not, because there are some things that make up some tea we drink that's lip tint. I think you can take lip tint. You can, because as long as you're not taking it excessively, it's okay. Yeah, as long as you're not taking. Let me just check what's made up of. See, you can see, like lip tint, as long as you're taking it in moderation, you're not taking too much of it. It's not bad. It's not. During my pregnancy, I took tea and I didn't really have any effect. What people believe is that when you take heavy tea, when you take Bonvita, Milo, it makes the baby big, and when it comes to push, it's difficult. Lip tint is not bad for pregnant women. As far as you're taking it in moderation, let me tell you something. As a pregnant woman, what I advise, this is my own personal advice, eat what your body feels like eating, but don't eat too much. Again, but don't eat it in excess. Like, there's some things you should stay off. Like, what I advise you stay off from caffeinated food, caffeinated drinks. You can stay off of that. Eat what your body wants, but don't eat it in excess. Don't like consume it in excess when you know it's going to be dangerous to you. That's what I advise. Can a baby's gender change after 4 weeks? Because it's amazing. Gender, it's possible the doctor did not see the gender. Like is it 4 weeks inside the womb or 4 weeks when the baby is out? Because I don't really understand. Like, if the baby's gender can change after 4 weeks, please explain and throw more light, so I don't explain what I don't know. I have some snacks. I have to eat this food before I go, so I don't end up getting hungry. I brought my breakfast here. I have some snacks. Oh, while I'm here, I came to work early. So I decided to go live and take some questions. I came to work early because I don't want to take the bus, and my husband is going for a training, so he has to drop me. And the only way for me to get is to get here early and stay back. Yes, so that's why I'm here. So I'm at work, but I'm not inside the workplace. I packaged my breakfast because I could not eat it. Abubakar, do you want to get pregnant? You said you did scan, everything is normal. How big is the stomach? Because sometimes that big stomach you are seeing might just be the food you are eating that's causing that fat in the stomach and nothing else. You can eat cashew nuts. Cashew nut is proteinous. You can eat it. Good morning, Kadin. I think I've answered everybody's question. Any more questions for me? Oh, you want to get pregnant? What advice is for you to know your safe cycle? Just know your cycle. Try and have sex on your ovulation dates. That's going to help a lot. I made a full video on what causes ectopic pregnancy, Edward Mubolo. Yeah, some people have already had, like, previous ectopic pregnancy can cause it. Like PID, pelvic inflammatory disease, can actually cause ectopic pregnancy. Like recurrent infection can cause pelvic inflammatory disease. Pelvic inflammatory disease can cause ectopic pregnancy. There are different things that can actually put one at risk of going down with ectopic pregnancy. I made a full video on that explaining it. You can watch it to get enlightened on that. Sorry, I'm eating and answering questions, so I have to swallow before I read. My wife is adding weight. How can she reduce? I think first of all is to have a conversation with her. Yeah, have a conversation with her. Let her know, okay, is there any possibility of you reducing? Help her work on her diet. Diet is very, very important. Yeah, when it comes to reducing weight, like the food she eats. Exercise is also very important. Yes, I think you should show your wife the video I made on how to reduce fat. How I was able to burn. Though naturally I'm not that big, but post pregnancy wise, I was able to like lose the fat away. I dropped a video on that, how to lose weight, like some tips on how to lose weight. It's on our YouTube channel. You can check, you can watch, and also share the video with her. Highness, I heard you use the first one. What drugs did you buy? That's one. What drugs did you buy for the yeast infection, Godwin? Because sometimes, if you've watched our video, I've explained the fact that sometimes what's actually causing that yeast infection is the product we are using to wash down there. We are using soap, we are using chemicals to wash down there. And when we do that, it alters the pH of the vagina. So that's why I'm always advising ladies, just use water. People they get angry when I say that. How will you use water to wash your vagina? Just use water, for crying out loud. Because you're using those soaps, those chemicals, you think you are disinfecting your whatever. You are only altering the pH. Eating and talking. You are only altering the pH of the vagina. And that is it. So that's why I advise just use your normal water that you are bathing. Just wash up when you're done. Because that actually predisposes you at risk of yeast infection. If you are using soap, you are using those scented wipes, things like that. It's not nice. Hello. I'm sorry, I had to look at the time because my work will soon start, so I'll be going. I'll just take as much questions as I can before I leave. Where did I stop? Oh, Owola B, were you typing something? Can someone get pregnant when see getting pregnant when a woman is on the menopause might be difficult, yeah. Yes. Except he has to go for some medical treatment that they will help to stimulate her ovaries to release eggs. Outside that, it's difficult. The possibility is like very, very low, slim chance, like very, very slim. Because once you are on your menopause, that simply means you are not releasing eggs, you are not ovulating, you are not seeing your menses. You get, so that's why it's really difficult. I can't really say the possibility of getting is like 0.5% of getting pregnant when you are on your menopause, except the miracle happens. You've heard of miracle babies. Brutally, there are a lot of reasons that can delay your menses outside pregnancy. Yes, stress can actually delay your menses. Stress can delay your menses. We made a video on that, causes of late menses. Yeah, you can check our YouTube channel. We have a video on that explains that, so you can check that. Sorry, I'm just trying to see I can pick some easy questions and take, because I'm about leaving now. I got to go. Where did I even stop? Varicose vein will be a full video on its own. I will explain what it means, what is causing it, and all that. This is not a good habit, eating and talking. Don't do what I'm doing. I have to take my breakfast. I have to do this one. I have to go to work. Don't know what I'm doing, please. Where did I stop? I see clots when I'm on my period. See, blood clotting might not be something you should be worried about, though. Seriously. Sometimes the blood clots. I made it. I'm coming. Let this person pass. It's nice. Postinol tab is good for prevention if you use it rightly. Alright. I'll try as much as possible to be doing live every morning, if to see how I can cope. Because right now I have to go, so I don't want to be late for work. Please, I'm sorry. I'll go through the questions. The ones I can make video on, I'll do it. I have to finish up my food. Grace, I said, seeing blood clots in your menses sometimes is normal. Yeah, but if you are worried about it, it's like how would I explain this to you? Okay, blood clot in your menses, if it's little, it's not big, it's a normal thing, you get. But if it's bigger than expected, I would advise you see a doctor. You get a little one like that usually pops up at the beginning of the menses, maybe at the end of the menses. Not something to be worried about. But if it's large in size and it keeps coming throughout your period, it is something you should speak to your doctor about. I think that's the last question I'll have to take. I have to go to work. All right, I'll see and answer. I'm sorry I can't take all of that questions. I wish I can, but I have to go to work. How do I end this thing? It doesn't want to end for me. Let's see. Are you sure that you want to stop the streaming?